Thanks very much, and I welcome this motion before us. I think it's important that we talk about this until the issue is resolved. And, you know, we seem to have been talking about shortcomings in mental health services for time immemorial, and yet nothing is being done, it would seem, in terms of bringing them up to the standard that is expected in a modern day and wealthy society. I think many of the problems impacting on our mental health services, and especially in relation to CAMHS, are actually a microcosm of the difficulties within the health service. So the kind of things that I'm thinking about is, you know, the whole question of capacity, recruitment of staff and workforce planning, the question of e-health. That is absolutely central, and we know in terms of poor record keeping how important that is. But also then the structure and how we organise our health service. The way the HSE is structured, the fact that we don't have accountability down through the different areas, so that, you know, we don't have the local manager coming on to account for how he or she provided services or failed to provide services or didn't spend money properly. There needs to be that level of accountability at local level, not simply just the chief executive coming on, apologising, which so often happens, comes on the airwaves, apologising for some serious failure and, you know, promises a report that we may or may not ever see. And I think that has been very kind of descriptive of the whole CAMHS situation. And of course, the other aspect in terms of the structure of the health service is the question, and it was referred to by the previous speaker, that we do have a postcode lottery. It's hit and miss, you know, whether a child can get access to services within a reasonable period of time, or if they're left waiting, in many cases indefinitely. And that's why we need that new structure within the HSE, where resources are provided on the basis of the needs of the local population. And that's the plan that's there that needs to be implemented urgently. So look, I think in the context of that, because it is very much a victim of the bigger problems and issues impacting our health service and the way we actually deliver those. But I think it's worth just reminding ourselves of the kind of appalling figures and the data that we get from CAMHS and the kind of couple of reports that we've seen over the past year or so. First of all, we know that 4,000 children were on a waiting list for CAMHS as of the 30th of November. Almost 1,000 of those, 25%, were waiting over 9 months, of which almost 600 were waiting over a year. Now, you know, when a child has a serious mental health difficulty, and we all know this from experience, and we certainly can imagine what it must be like if we haven't had first-hand experience. But when a child has a mental health difficulty, that child's case is urgent, and they have to be seen. They have to be seen within a reasonable period of time. And the idea of there being, you know, 1,000 children waiting over 9 months. 1,000 children waiting over 9 months. Like, 9 months is an eternity in a child's life. And like it's almost a year lost out of that child's childhood. But what happens in the meantime? What happens to the child themselves? What happens to their distraught families? And, you know, families do get distraught in those circumstances. What happens to their education? What happens to their social connections and their networks? All of that is put at risk because of these waiting lists. And, I mean, a shocking thing about that then is that they're the long waiting lists. When you look then at what has happened to the budget, we know that almost half of the allocated mental health budget last year was not spent. Okay, so of the €24 million allocated in 2022, 11.5 million of that was not spent. I mean, that is just unforgivable. A situation where we have crisis waiting lists and half the money isn't spent. Now, you know, poses a major challenge, or should pose a major challenge to the government to address this issue. Why is it that the money isn't spent? Is it because we've got awful recruitment procedures and HR procedures within the HSE, where, you know, whether it's South Kerry or Northwest Donegal, you have to apply to Dublin to get approval for a post, irrespective of, you know, how much of a priority local management might think attaches to that post. It's somebody up in Dublin who decides whether that funding will be approved or not. And then there's the big long rigmarole of the recruitment. And then the likelihood is that there are not people available to fill those posts. And that raises all kinds of issues in terms of the lack of responsibility by government, by the HSE and by the Department of Health in having proper workforce planning. So increasingly now we're seeing budgets being provided, additional money being provided, and it can't be spent because we don't have the intake and the graduation from colleges, and we don't have the healthcare placements. We also know that the Mental Health Commission, their interim report, found serious concerns and consequent risks for some patients in 4 out of the 5 CHOs that they've reported on. I mean, that is a damning figure. Serious risks and consequences in 4 of the 5 CHOs. And there's no reason to think, you know, the other remaining 4 CHOs that haven't been reported on are any different. One of the worst aspects, I think, of the Mental Health Commission's report there recently was the question of lost cases. And the interim report highlighted open cases that were lost in the system. Like children's cases that are lost in the system. Children lost to follow-up care. So, you know, you could have children waiting 9 months, 12 months more to get into a service, and they get some level of care and treatment, and then they're lost to the service. I mean, this included children on medication, with some reaching their 18th birthday, with no discharge or transition plan. On one team, 140 open cases had been lost to follow-up care. Another team did not follow up with children on continuing medication for up to 2 years. Up to 2 years. I mean, the negligence involved in that. Of course, in relation to the digital infrastructure, which I've already referenced, we know that the e-health strategy is 8 years old. There is no record keeping, or virtually no record keeping, in many aspects of our health service. So how can you supervise and how can you manage a service if you don't have proper data collection systems and you cannot monitor and keep a track on what is actually happening in the services? How long are people waiting? How many people are waiting? You know, how many staff have we got? How many vacancies? All of those key things. What's the length of time children stay in the services? So, you know, that saying, which I often quote, what matters gets measured. And if we're not measuring activity within the health service, clearly then that doesn't matter. And like, we have a huge problem with the lack of data and data collection and data analysis, and you cannot run services in those circumstances. Of course, the interim report on the 5 CHOs used paper-based files. Paper-based files in this day and age. The report states that patient files were frequently disordered with little logic to the filing, and clinical notes were frequently illegible and at times were incomplete. Without a digital patient management system, the report concludes that it is difficult to see how improvements in the quality of the CAMS service can occur. The business case for deeper must be a priority in relation to this. And of course, when it comes to the whole area of restructuring how we provide health services, key to that is ensuring accountability. So, you know, all this money goes in, there's a failure in the service, and who's held accountable? Nobody. We get an apology, yet another apology, and a promise of a report, and nobody is held accountable. As long as you have a situation like that, where there are no consequences for failures in delivering services or spending budgets, well then you're going to have a dysfunctional system. Equally, I would say in relation to the whole kind of area of allocating resources. Resources are allocated on a historic basis, or what constituency happens to have a minister. That has to end. And as part of the regional health authority structure that was recommended by Sláintecare, that it seems to be taking forever, as part of that, not only do you have integrated care, not only do you have accountability of staff, but you also then have objective resource allocation, and that is critical. The resources, the budget that is allocated has to reflect the level of need in the areas and not just be an ad hoc chance thing. Look, there are so many things there. So many of those problems relate to how we organise our health service, the lack of investment, the lack of priority being given to some of those big projects. And, you know, the Minister and the entire government needs to get behind making our health service fit for purpose and fit for the modern day.
Thank you.